Hi, my name is Holland Clausen, and I'm applying to the DNP-Family Nurse Practitioner program at Weber State. If I were to describe the DNP degree, I would say that it teaches nurses how to apply research and scientific findings into clinical practice. It would build upon my foundation as a nurse and utilize my previous clinical experience. A nurse practitioner is a provider of care, and it is their responsibility to diagnose and treat symptoms and underlying causes. This is done by ordering treatments, tests, medications, and performing procedures. It is important for the nurse practitioner to keep up to date on research in order to implement current best practices. I entered the ICU during the pandemic, so I was able to see this firsthand on a global, critical scale. I would like to describe to you a few of my personal strengths. I was diagnosed with anxiety when I was very young. Although that might not initially sound like a strength, it has given me the ability to empathize with patients who are experiencing the same thing. I understand what it's like to feel afraid, uncertain, and apprehensive. Because I've had this diagnosis for so long, I've been able to develop many tools to help me identify and handle my emotions. After my time as a nurse, especially being in the ICU, I am able to prioritize and manage my time. Sometimes in the ICU, you have one patient who is nauseous, another one whose propofol drip is running low, and then a third one who has a tanking blood pressure. And you have to try and do that all at once, and you have to decide what to do first. As cliche as it sounds, I love learning. I've always had a desire for a depth of understanding. If something interests me, I do a deep dive and I read all about it, whether it be sports, historical events, animals, or whatever piques my interest. That being said, I really appreciate the little details, and this is largely what motivated me to pursue the DNP degree. I have the strong desire for a greater understanding of pharmacology and anatomy and disease processes, and being in the structured, focused program that is the DNP will give me the tools and information needed in order to care for patients in a more in-depth way. As a nurse during the pandemic, I've had to give countless updates over the phone to loved ones regarding the status of their critically ill family member who they couldn't come in and visit. I had to describe their complex status and treatment plan in a way that they could understand. That being said, I would strive to be an approachable provider for my patients and ensure that they have a proper understanding of their conditions. Obtaining my DNP will open doors for me to promote health and affect change in my local community. I believe that change starts small with one patient at a time. I look forward to enhancing my current role as part of the ever-evolving science that is healthcare and utilizing and promoting new treatments and research that could benefit people all over the world. Thank you for your time and consideration.